There are a lot of different parts of Medicare, and it's important to understand what part does what. So today, I'm going to talk to you specifically about Medicare Part A. We're going to talk about the costs associated with Part A, as well as the coverage of Part A. And this is really important information, so stay tuned. Hi, I'm Jamie Banner. I'm the founder of Medicare by Jamie, and I'm a licensed insurance agent that works specifically with people enrolling into Medicare. And today, I'm going to talk to you about Medicare Part A. Now, before we get into it, if you find this video helpful, I'd appreciate it if you give it a thumbs up and subscribe. Leave a comment down below. It lets YouTube know that this is some important information and people will be able to find it much easier. So let's dive right in. We're talking about Medicare. So when you get close to your 65th birthday or possibly past 65th, you're going to get your Medicare card. So you've got this nice red, white, and blue card with kind of a ton of information on it, right? It's got your name, it's got this Medicare number, and which is numbers and letters, and it's got a Part A and Part B effective date. So that's right, when you get this card, you got two different parts of Medicare on there. Part A and Part B, and they've also got effective dates, which means they don't have to start at the same time because they're two different things. And today we're going to talk specifically about Part A. So when we talk about Part A, we are talking about the hospital. That's the easiest way to think about it. Your Part A insurance is your hospital insurance. So all the things that happen while you're hospitalized fall under your Part A. Once you leave the hospital and you're back home and you have other things, that's a separate part of Medicare. But Part A is going to be pretty much best way to think of it is your hospital stay. So Part A, like I said, hospital care, but that's not quite all of it. It can also cover skilled nursing care. So if you're discharged from the hospital to maybe a rehab facility, you need a little extra help, that's under your Part A, as well as hospice care and some home health care. Now, big important part. What does Part A cost? First thing we know is no premium. That's pretty exciting. That's why we want Medicare. We want premium free. That's the exciting part. But as you can see, there's a little bitty asterisk because it's not premium free for everyone. So how do we find out, do I have Medicare Part A premium? Well, if you've worked 40 quarters, which is 10 years, or you're married to someone who worked 40 quarters, your Part A premium is free. So you pay no premium for your Part A. Now, if you worked 30 to 39 quarters, your Part A premium is going to be $252 monthly. So it's a pretty steep jump. And then if you worked less than 30 quarters, your Part A premium is going to be $458 monthly. Again, big jump. So there's kind of these three levels. If you've worked 10 years, a little bit less, or even less than that, you can see the changes in the premium. Next thing is your Part A deductible. So the Part A deductible is $1,408 per benefit period. Notice that does not say annually. That is per benefit period. So essentially what that means is if you are hospitalized, once you're discharged, you have to go 60 days. And once you get past those 60 days, the deductible resets. So if you're hospitalized 61 days later, you pay that deductible again. If you're hospitalized again within those 60 days, that first deductible counts. But anything past that 60 days, you will pay that deductible again. So again, it's not annually, it's per benefit period. And there are ways to get that covered. For instance, a Medicare supplement plan. A lot of plans cover that Part A deductible. And that's what I do. I assist people in finding the best Medicare supplement plan option to meet their needs. You can always call me, 833-65-JAMIE, or visit my website, medicarebyjamie.com, and I can walk you through how to get into a supplement plan to pick up costs like this Part A deductible. The last Part A cost we're going to talk about is the Part A coinsurance. So, Part A is no premium, right? And you go to the hospital, it's free for some of it, but if you have a really long extended hospital stay, you're going to end up paying some coinsurance. So days 1 through 60, your coinsurance Part A is $0. It's free, no coinsurance, and that's going to be stuff like semi-private room, your meals, all your medical care in the hospital, things like that. But if you had a pretty significant event happen and you're hospitalized 61 to 90 days, your daily coinsurance is $352 a day. So yeah, that's kind of steep, but like I said, most people aren't hospitalized more than 60 days. It has to be a pretty traumatic event. And then if you're hospitalized 91 days or beyond, you're paying $704 a day. And this is where you dip into your lifetime reserve days. So you have a specific amount of reserve days for your entire lifetime. And once you're past 91 days in the hospital, you're going to start pulling from those reserve days. Again, not a lot of people are hospitalized for consecutive 91 days or longer, but these would be your coinsurance charges if you were. So if you're discharged from the hospital and you go to a skilled nursing facility, maybe you need some physical therapy, some speech therapy, things like that. Days 1 through 20, zero coinsurance, no copays. Once you get to 21 through 99, it's $176 a day. Again, you have a supplement plan. A lot of times those will pick up these coinsurances because you are generally Medicare Part A gives you 100 days of skilled nursing care, but you need something to pick up that supplemental that they're not paying for. And then if you go past day 101, you pay all costs. So Part A no longer pays anything. You're paying 100% of your stay past day 101. So, like I said, again, Part A, best way to think of it is your hospital insurance. Everything that happens in the hospital, Part A. Inpatient surgery, Part A. Skilled nursing facility, Part A. Part A is the hospital. I'm going to just keep reiterating that. It's really the best way to think about it. I hope this video helped explain to you kind of what is covered under Part A and what your costs might be associated with Part A. If you have any questions, you can always call me. My number is 833-65-JAMIE. You can visit my website, medicarebyjamie.com, or you can email me at jamie@medicarebyjamie.com. If you like this video, please give a thumbs up and subscribe. Leave a comment down below. Like always, I put a movie quote in there. If you can tell me what movie it is, put it in the comments. And stay tuned because I'm going to give you a tour of my website where I'm going to show you all the important and, more importantly, free resources I have for you to use on there. We've got forms, guides, everything you could need to help make your Medicare journey a little easier. So again, thank you for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the homepage, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.